In this video, you will learn how to use Minitab with the healthcare module to reduce hospital readmissions that happen within 30 days of discharge. Our data consists of variables that potentially cause a hospital patient to be readmitted within 30 days. Because each patient was either readmitted or not, this particular key performance indicator has two possible outcomes. We will focus on using tools that are useful for the case of two possible outcomes. Let's start by obtaining a visualization for the current 30-day readmissions in a healthcare system. To do this, we'll select the healthcare module, then our healthcare KPIs option, and then we're going to want to select the 30-day readmissions option under the utilization menu. And in the readmissions menu, we're going to select the visualize 30-day readmissions option. We then see all of the suitable tools for visualizing our readmissions. Click the information logo for more information on how to set up your data and run the analysis for any of the techniques for analyzing 30-day readmissions. And this help and context comes from the Minitab online support menu. We'll start visualizing the percentage of 30-day readmissions using a pie chart. We'll select the pie chart option, and then it's going to ask for a categorical variable. And our categorical variable is readmitted. And this column in the worksheet contains information about whether a patient was readmitted within 30 days. Then we're going to select OK to render the pie chart. You can see roughly 8.3% of the patients in this healthcare system are readmitted within 30 days. By understanding what drives patient readmissions, we can develop plans for prioritizing high-risk patients and preventing this from happening. In the worksheet, we can see some potential drivers of readmission from the data we have. This includes the number of days in the hospital, procedures that were done, diagnosis, where patients were admitted from and discharged to, plus a few additional demographics. Let's return to the healthcare module to use a predictive model to mine the data for the reasons that patients are readmitted within 30 days. Back in the readmission section of the healthcare module, this time we will select the Predict 30-day readmissions option. We have three predictive models to choose from. Because we have multiple predictors, we can focus on these options. When choosing between predictive models, it is common to run multiple models and choose the model that has the best predictive accuracy for rows of data not used in the model fitting process. Let's start by choosing the Use Multiple Predictors to Predict 30-Day Readmissions option to fit a binary logistic regression model with these data. The response is the KPI whether the patient was readmitted or not. This categorical variable has two possible outcomes. In other words, it is binary. The response event is yes, meaning we will model the proportion of patients that have been readmitted within 30 days. A continuous predictor measures something about a person or process, such as a patient's age. The continuous predictors here are the patient's age, number of hospital days, labs done, procedures done, medications, outpatient visits, emergency visits, and diagnoses. So I select all of those. A categorical predictor is a category or a condition such as a patient's diagnosis. The categorical predictors here are race, gender, where the patient was admitted to, where the patient was discharged to, and then whether the patient has diabetes or not. We then click the Stepwise button. To select between multiple models, you want to choose a model that predicts well for data not used to fit the model. This is known as validation. When we use a test set to validate our model, Minitab will hold out a certain percentage of randomly selected rows, fit the model without those observations, and then measure how well the model predicts for those held out observations. By using forward selection with a test set, Minitab will pick the best predictive model based on the accuracy of the predictions for the 30% of the data held out from the model fitting process. We then select OK to run our model. With classification models, like binary logistic regression, we often use the area under the ROC curve for the test data to assess the model's predictive accuracy. A model that simply classifies outcomes at random has an area under the ROC curve of 0.5, while a model with a perfect fit will have an area under the ROC curve of 1. Here, the test area under the ROC curve is 0.6972. This indicates that the model predicts better than if we simply classified patients at random into readmitted and not readmitted categories. Now let's compare the predictive accuracy of this model to that of another classification model, a CART classification tree. We return to the healthcare module, back to our healthcare KPIs, and then back to the readmissions section of the healthcare module, and we again back to the predict 30-day readmissions option. This time, we select the use complex relationships with multiple predictors to predict 30-day readmissions. The response and the continuous and categorical predictors are the same as for the binary logistic regression model. To run this model, we then select OK. The test area under the ROC curve for the CART classification model is 0.7018. This is higher than that of the binary logistic regression model, indicating that the CART model better predicts for held-out data. Let's look at some results from the CART classification model. Relative variable importance values range from 0 to 100%. The most important variable always has a relative importance of 100%. Notice that the most important predictor of a readmission within 30 days is their number of actual diagnoses a patient has. The second most important predictor was the location to which the patient was discharged. Now we look at the actual CART classification tree. A classification tree partitions the data into groups with high chances of readmission and groups with low chances of readmission based on business rules obtained from the predictors. The overall percentage of readmissions is 8.2%, but if we consider the impact of the most important predictor variables in the model, we can find groupings of patients that had much higher chances of readmission. For example, patients that had greater than 4 diagnoses and left against medical advice or were discharged to another hospital, long-term care, or skilled nursing facility had a 16.8% chance of being readmitted within 30 days. And we see that in this node below. Knowing this, you can now put procedures in place to reduce the chance of readmittance for patients that fall in this demographic and others that correspond to high readmittance risk. To obtain a prediction for the probability that a new patient will be readmitted within 30 days, we can click the Predict button in our output. For example, a patient with these attributes displayed has a less than 2% chance of being readmitted within 30 days, so it does not appear likely. With that said, I want to thank you for joining me today. I hope this short overview gives you some ideas for how analytics in the Minitab healthcare module can help you determine the important drivers of patient behavior and use that insight to prioritize your process improvement efforts.